Decreased preload due to hemorrhage. A 54-year-old man is brought to the emergency department after a motor vehicle accident. He is pale, diaphoretic, and confused. His vital signs are blood pressure, 85-50 millimeter Hemorrhage, heart rate, 120 BPM, respiratory rate, 22 min, oxygen saturation, 97% on room air. Physical examination reveals cold, clammy skin and flat neck veins. There are no signs of external bleeding. A bedside fast, focused assessment with sonography and trauma scan shows free fluid in the peritoneal cavity. Question: which of the following best describes the hemodynamic changes in this patient due to hemorrhage? A. Increased preload, increased cardiac output. B. Decreased preload, decreased stroke volume. C. Increased preload, decreased afterload. D. Normal preload, increased cardiac contractility. Answer B. Decreased preload, decreased stroke volume. Explanation: this patient is experiencing hypovolemic shock due to intra-abdominal hemorrhage. The loss of blood volume leads to decreased venous return, preload, reduced stroke volume, and compensatory tachycardia in an attempt to maintain cardiac output. According to the Frank-Starling mechanism, a lower end diastolic volume results in a reduced stroke volume and cardiac output. Preload due to hemorrhage and reduced circulating volume, stroke volume. Less ventricular filling leads to reduced output. Compensatory mechanisms: tachycardia and peripheral vasoconstriction. Why not the other answers? A. Increased preload, increased cardiac output. Incorrect. Hemorrhage reduces preload, leading to decreased cardiac output. C. Increased preload, decreased afterload. Incorrect. Preload is decreased, not increased. Afterload may increase due to compensatory vasoconstriction. Normal preload, increased cardiac contractility. Incorrect. Preload is not normal. It is decreased due to blood loss. This scenario illustrates hypovolemic shock with decreased preload and a shift of the Frank-Starling curve downward due to hemorrhage. Treatment involves aggressive fluid resuscitation and blood transfusion if needed. Would you like an accompanying